Hi, my name is Jake Darling. I'm going to be demonstrating a subcutaneous injection today. So follow me to the bedroom. We're going to review our physician's orders. So for today's date of February 7th, 2021, time of 07:40 in the morning. It's a blank sheet. I don't have extra desk space, so I'm going to put that over there. We're going to compare the physician's order sheet to the MAR. So, right patients for nursing Jake, FIN number 312-312-654-654-98797, date of birth January 1st, 1960, date of birth January 1st, 1960. There's no known allergies. So there's a transcriber and a reviewer on both medications on the physician's order sheet, and there's two transcribers for both the medications on the MAR. So we'll get into it. So right medication on danzatron, right dose, 6 milligrams, right route, intramuscular, right time and frequency is daily, before supper for 1700. It is currently 07:40 in the morning, so I'm not going to be giving on danzatron today at this moment. So right medication, heparin, right dose is 5,000 units, right route subcutaneous, and right time and frequency is daily for 0800. It is currently 07:40 in the morning, so I can indeed prepare and administer this medication. And like the other sheet, we'll just pretend I put that away. Okay, so now I'm gonna wash my hands and I'm gonna gather my supplies. So firstly, I'm gonna look at my, I need my heparin. So with the heparin, this is a single-use vial. It is 5,000, there's 5,000 mLs, and it's per 5,000 units per 0.5 mLs. There's 0.5 mLs in the bottle, so I have to drop all the medication. It's indicated for subcutaneous use, so that's perfect. And expiration date is good. So the next, I'm gonna have to grab a blunt fill needle, my syringe, can use a 3 ml because I don't have like a 1 ml. And then for a subcutaneous injection, a 27 gauge half-inch length is safe to use for a subcutaneous injection. Okay, and I'm just going to review the drug monograph. So for heparin, it is indicated for subcutaneous use undiluted. I did not dilute the medication, so we're good. Maximum dose is 10,000 units. I'm giving 5,000, so it's a safe dose. And yeah, so now I'm gonna wash my hands. Now we're going to use the alcohol swab for 30 seconds in a circular motion to clean off the vial. We'll pretend that it's been 30 seconds. So now I'm gonna prepare a syringe. Put that into the garbage too. Gotta wing this back to maintain sterility. In the garbage. And because we're drying up half an ml, I'm gonna have half an ml. And make sure that it's in the medication the whole time. I'm gonna insert the air and slowly draw it up. All the medication. Okay, good. So now we'll draw that out of there. We'll switch needles. They'll go into my sharps container. So now we're going to wing this back. Maintaining sterility the whole time. In the garbage. So now I'm just going to prime the needle over the med waste, ensuring that I have exactly the 0.5 mLs, which I do. Very good. Make sure there's no bubbles. is primed. Perfect. Okay, so now we're going to do up our med label. So for nursing Jake, drug name heparin. I'm going to do a subcut. Dose is 5,000 units. Volume of half a mil. Concentration is 10,000 units per 1 ml. Take time is for 07:40 in the morning for February 7th, 2021. And my destination signature. Okay, so now we're going to do our second check. So, right medication, or right patient, nursing Jake, right medication, heparin, heparin. Right dose, 5,000 units, 5,000 units. 5,000 units is 0.5 ml, so I need half an ml. I have half an ml. Right time and right route is subcutaneously, and right time and frequency is daily for 0800 0740 in the morning, so it's safe to give it. Okay, so this can go into med waste. We'll just pretend that's right there. Okay, so now we're going to just gather up our supplies. We get this, our gloves. We need a new good alcohol swab. We need a 2x2 to hold on the site, and that should be everything. Okay, so we can remove my MAR, and it should be also noted, in case I forgot, that patient has no known allergies, so I can confirm that with the patient. So I'm going to enter the patient's room. I'm going to perform hand hygiene. I'm going to do an entrance safety check. There's no hazards on the floor. Patient's in no distress. So I'm going to introduce myself. Hi, my name is Jake Darling. I'm a student nurse at the University of Manitoba. I'm here to administer some medication for you today. Can I get you to state your full name and date of birth for me? Nursing Jake, January 1st, 1960. Okay, great. I'm just going to confirm that with your wristband. So Nursing Jake, date of birth January 1st, 1960. January 1st, 1960. Great. And do you have any allergies? No? Okay, great. That's we have on file. So now I'm just going to put the patient in raise the head of the bed up, to an appropriate height for me. Obviously I can't do that on this bed, so we'll just pretend I did that. I'm just gonna request the patient to bear with me while I do my third check. So, right patient, nursing Jake, right medication, heparin, right dose, 5,000 units, which equates to half an ml because it's 10,000 units per 1 ml. I indeed have half an ml. Right route is subcutaneous, and right time frequency is daily for 0800 0740 in the morning. It is safe to give. Okay, so now before I give this medication to you, I'm just going to explain a little bit about it. So firstly, I'm going to be administering heparin for you today in a subcutaneous injection. Heparin is an anticoagulant. So now I've assessed you for a history of hypersensitivity, such as that of heparin-induced thrombocytopenia, a very common side effect, and hypersensitivity reaction. Also assessed your APTT levels, as well as your for any reduced renal function, which you do not have, so that's good. Some common side effects you may experience is some bleeding around the injection sites, just like an ease of bleeding in general, and hemorrhaging, to be precise. You can also end up having reduced renal function, and with extended use, you can end up having, you can actually end up developing osteoporosis, but you shouldn't have to deal with that problem because this is only for a short period of time you're going to be on this medication for. So for some patient education, it's important that you refrain from drinking any alcohol, as this can, as alcohol can actually thin your blood and can negatively interact with the heparin. Also, it's important that you do not take any medications that contain aspirin in them, as aspirin has antiplatelet-like properties. So yeah, are you okay with me administering this medication for you today? Okay, great. So now I would just landmark the site. So I'm going to go 5 centimeters away from the patient's umbilicus to the lower right, just in the lower abdomen, right into the subcutaneous tissue. So that'll be, for this demonstration purpose, we'll pretend that's my area. So now I'm going to just don some gloves. And before I do that, technically you should always wash your hands. So wash your hands, then put on the gloves. Sorry. Okay, so now I'm going to just get this out and ready for the patient. So now I'm going to, now that I've landmarked the area 5 centimeters down to the right into the lower abdomen from the umbilicus, I'm going to clean it in a circular motion for 30 seconds. I'm slowly working my way outwards so that I have that clean. I'm going to leave that there just so I can get my site of reference. Now I can get this out. So I've grasped 2 inches, so I can insert this at a 90-degree angle. So in, now I'm gonna just stabilize, inject the medication, and then just pull out while still maintaining pressure on it, and I can slowly release. Now I would cap this needle, but for these purposes, like I would actually just activate the safety, but for these purposes, we'll just pretend I did that. And just put that there and put that, and this would go into the sharps container. So patient, and that would have been done quickly, out of the way. Patient would have been given the 2x2 to hold onto the site for 30 to 6 seconds, just to help with any bleeding from the injection. So now I'm going to remove my gloves. I'm going to perform hand hygiene. I'm going to document the medication. Document that I've administered it at the time. So now I'm going to ensure the bed's in the lowest position. Patient's in no distress. Arm rails are up. Call bells in within reach. Now I'm going to continue to monitor the patient's APTT levels. Make sure that it's 1.5 to 2.5 times the control value, as well as monitoring the patient for any signs of bleeding anywhere and bleeding around the injection sites later that may develop. And yeah, so now I do my exit safety check, cleaned up all my mess, sharps in the sharps container, bed's in the lowest position, call bells in with reach, and yeah, end scenario.